Good evening, everyone. I hope you all are doing well. This will be the case study and doubt session. So, without taking much of your time, I would like to invite Dr. Somya Soin, ma'am, to continue today's session. Ma'am, the stage is yours. Thank you.
Thank you, Priya. So I'll just share my screen now. Okay. Okay, so very good evening, everyone. So today we are going to understand about certain case studies in forensic anthropology. And as I already told you that today we'll have certain videos as well for some cases. Okay, so in total we'll be discussing 5 cases. Okay, and some will be having certain certain article text. Some will be from a particular case report. We'll discuss the complete article and some videos will be there for the cases. So I just want every one of you to just listen and understand how whatever we have studied till now in the 2 previous lectures, how we can relate those things with each and every case. Okay, so we'll go a little slower so that you understand each and every detail of every case, and don't worry, it won't be boring at all, right? Okay, so firstly, we'll start with a short case. So, as we all are aware that Jeffrey Dahmer case is the case of a serial killer. He was responsible for 16 deaths, 15 deaths in Wisconsin, and one death in Ohio. So this case is from US, and between the years 1978 to 1991, there were 17 men and boys who were actually, missing, and 16 deaths were, happened in Wisconsin, and one was in Ohio. So basically, in 1992, Jeffrey Dahmer was convicted for this murder of the missing people. Okay, so basically, what happened that whenever we are solving any case, as I already told you, that each and every aspect, whether it is forensic science, forensic pathology, anthropology, odontology, we try to incorporate each and every team member and each and every, domain so that we can get to a particular conclusion without any sort of, less probable results. So basically, what happened in this case, the thing that actually was bothering is that we have included forensic anthropological cases right now. Okay, so how forensic anthropology helped in this case, I'll be dealing with that part. Also, certain forensic DNA analysis was being done for this case and for some other cases as well. I'll mention that. But how forensic anthropology helped in this case, we'll discuss about this thing. Okay. So basically, what happened that doctors Bob Mann and Stephen Ousley from the Smithsonian Institution, they were being consulted to, identify the remains of this one victim who was Stephen Hicks. You can see the picture here, this one. Okay, so for this person, they were trying to do the identification through forensic anthropology. Okay, so basically, what happened that this particular individual was being, his case was being considered because the killer actually confessed that he killed this person and dismembered the remains, dismembered all the body parts, buried them, digged them, dissolved them in acid tubs, okay, and crushed and sledgehammered all the remains. So basically, the remains were found in a very pathetic situation, scattered all around, and so anthropologists got 26,000 bone fragments. See, the body went through so much, right? Dismembering, burying, then, after so many time, after a long time, the body was, examined and acid burning, each and everything actually gets so much to that bony parts that they were actually fragmented. And 26,000 fragments is actually a very big challenge for forensic anthropologists also, right? So basically, they were being asked to identify that whether these all bone fragments are of this particular individual only, or they are also for that different people, different deaths. different missing people who were missing, and people are doubting that they only died. So the each and every piece was being examined by the forensic anthropologists, and then they were able to conclude. See, each and every knowledge for forensic anthropology, the bone parts, the sides, the sex determination, each and everything they actually considered, and then they said that no, these all fragments are of this one person only, of the one victim only. Okay, and particularly the two main findings that they were able to find for this Stephen Hicks were that there was this tooth root that they were able to reconstruct, and the vertebra. Okay, so basically they were able to reconstruct and compare these two parts with the medical records of the missing persons. So the medical records, as we discussed yesterday, right? Antemortem and postmortem records. So the antemortem records are the missing persons records, right? So basically these all were missing, and they were all dead. They were all killed by this person, Jeffrey Dahmer. So basically, for this record of the reconstructed tooth root and the vertebra, they were able to relate with the medical records of Stephen Hicks. And due to the several similarities that were present with the bone fragments and X-rays, they were able to say that these two parts are matching properly, okay, and the other parts, the other consistencies of the bones were also, superimposing with those of the X-rays of that particular victim. So then they were able to do a positive identification out of it. So this one case out of the 17 deaths, see 16 deaths are for one region, Wisconsin, and one in the Ohio region. I hope this is clear. So basically, these all cases were being solved with forensic DNA analysis, but with this one case that forensic anthropology was being highlighted, and anthropologists were able to identify positively this Stephen Hicks named victim. Okay, so this was a very simple and short case. Now we are going towards the Gilgo Beach murders. Okay, so basically, there was this beach in US itself. I'll show you. See, this is how they have mapped it. Okay, and the crime scene mapping, you all are aware, we do each and every sketching, recording, we use each and every indicators, right? GIS, GPS, whatever we can use, right, to basically locate the geographical markers of the remains. So this is basically a short, you know, a view of how actually the remains were found on the sides of this island, and at how many distance, how much distance. So 0.16 miles, 0.07 miles, 0.28 miles. So this was basically the geographical location of the remains of these people who were actually identified positively. Okay. So basically, in this way, the remains were being found on this beach, the island, and what happened that forensic anthropologists were being called from the New York City office, and basically, the chief medical examiner was also there, and they assisted in the search and recovery of all these remains. Okay, so 11 sets of remains were discovered, actually recovered from that area, from the sides, from around this island, from this beach. Okay, they have mentioned certain photographs. This is one view of the island. Okay, so this happened between 1996 to 2011. So, it was found that there is a long island on the beach of it, on the stretch of the beach of it. There are a lot of remains at certain distances. And, Rex Muirman, basically this person, he said that yes, he just confessed that yes, I killed 7 people. Okay. And what happened that how he killed them, we'll just understand this in brief. So basically, when he was trying to, he killed those people, and he tried to, basically dismember their bodies and basically put those around the core of the island. So basically, on the beach, there were different. remains and how they were actually discovered by the forensic anthropologists that we are going to understand. Okay, so just listen very carefully. So the remains were there in the advanced stages. Okay, there were 11 sets of remains. What all we have studied, everything is covered here. So they estimated the age, they determined the sex, the height, the stature, okay, the geographic ancestry, and physical characteristics of the bodies in an effort to compare them with the missing persons cases. Again, they had this, antemortem data, or we can call the missing persons database. Okay, so there was this one victim, John Doe, okay, who was determined to be male through anthropological analysis, right? Between 17 and 23 years old, as I said, there is an age range, and the stature or the height was approximately 5 feet 6 inches. Okay, so they determined he died 7 to 12 years prior to discovery. So the time of death also was being discovered. Okay, then what was the role that forensic anthropologists actually played? Not only the biological profiling, as I have mentioned here, they also analyzed the trauma. Okay, so what kind of trauma was that? Whether it was sharp trauma, blunt force trauma. Okay, so to several of the victims, there were a lot of signs of dismemberment, and then they reassociated the remains. They were being found that okay, there were these remains of this particular one person. This set is belonging to this person. This person. Okay, so basically, forensic anthropologists first needed to understand how they are completing the skeleton. The first lecture that I took, in that only I mentioned you. I told that first role of this forensic anthropologist is to basically understand, are these bones belonging to this individual based on, the sex determination, age, consistency of the bone, ancestry, each and everything they need to see. So a rough idea has to be made, and then it is confirmed by the DNA analysis, right? DNA, then it is confirmed by firstly the comprehensive forensic anthropological analysis in the lab, and then the DNA analysis. We all are aware DNA analysis is a gold standard, for the identification process. So mostly from the bones only, we get certain bone marrow and some sorts of tissue, that not tissue, but like some bones from which we can actually do the DNA analysis. Even if the teeth are present, I told you that teeth are a very good source of DNA. So in this way also the DNA is analyzed, and then because family people were having their, the DNA reports were available because of the family members, so they were able to relate those reports, and then they were able to not only reconstruct the biological profile through these parameters, but also confirm positive identification through the DNA analysis. Okay. And then they were able to say that, okay, as this killer has already confessed that he has done 7 murders, so they were able to tie that to him. But I'll tell you just one more thing. See, this happened in 2000. The remains were recovered in 2010 and 11. Okay. And now, if you go to Google, see, if you type this Gilgo Beach murders and you see the news 2 days ago, will DNA reveal more Gilgo Beach serial killer victims? We are in 2026. The case is still going on. 22 hours back, it was, in the news that this Rex Heuermann, who's the killer, he was being transferred to the Dutchless country prison. I'm so sorry, Dutchess country prison. Okay. And for lifetime, he has been transferred there. See how much time was, that person confessed that 7 people have been, I killed 7 people, but still how much time the judiciary took, that till now the case is going on. And you know how I got to know about this? In my Google feed, it showed, it popped up immediately. So I thought that, oh, I have also mentioned this case. Let me check. Then I just checked it and I got to know, अच्छा अभी भी चल ही रहा है. This case is still going on. And this case is also available on YouTube. Like not exactly the case, but the hearings of the case and certain clips of this killer are available. So you can see those, but if you are understanding it in a forensic anthropological aspect, you need to, understand how the things were being done. Okay, so these two cases were short cases. Now we'll go to a little, different case. Okay, so this case is, I will be discussing how the case was received and how it was processed, okay, in depth. Okay, so this is the case number, okay, whatever information was being received by the forensic anthropological team, okay, and they also had a senior forensic imaging expert with them, okay, just listen very carefully. So this is what all information they got. And how they got the body, they have just described it in these notes, and what all information they were able to process at this scene of crime or at the site. Okay, so this person was a male between 25 to 40 years of age and from the Hispanic ancestry, basically those the ancestry wherein Spanish is being spoken as their language. Okay, height is around 5 feet 1 inches. All anterior teeth were present at the time of death and in good condition. How the body was found? The decomposed body was found just outside the Bronx Zoo in June 2000. Okay. See, June 2000. Again, mark the year. Clothing found on the body included a tan brown collared button up shirt, corduroy pants, brown belt, and gray socks with white tips. See how much detailing the forensic anthropologists have to write. Then what they discovered, as the body was decomposed, right? It means the face would not have been that clearly visible. Okay. Wavy black hair, about 3 inches long, and black mustache. Why I'm saying the face would not have been that clearly visible? Because they haven't mentioned any facial features. You're getting it? Whatever they have mentioned is all. This is all they got. Okay. Now I'll show you how they solved this case through the video. Okay. So basically, Joe Mullins is the senior forensic imaging specialist. Around 1 month ago, he posted this. Okay, and why he posted this, I'll just tell you once, then I'll play the video. So basically, from the national, unidentified and missing persons system, he got this case from New York. Okay, and he got this case along with the team of forensic anthropologists and his own, expertise in forensic imaging. He just tried to reconstruct the face. See, whatever information we are having, just see very carefully. We had this much information, okay? What that person did, what they have done, that the body was decomposed, they tried to, firstly get the data for the skull of the body. They could have done radiographical analysis, but in such a way that they 3D scanned the skull, okay? And how the 3D scanned the skull, because they got the body in a partial decomposition way, right? Hair are present, clothing is present, not only bones. So much things are already present. See, clothing is there, hair is there, so it is very much visible the body was partially decomposed, right? It wasn't fully decomposed. So basically, what they did, they just tried to do the radiographical analysis and got the features of the skull. And after that, from the features of the skull, they related the data that how, what can be the age, what could be this, what could be that. Okay. And just 1 second. Okay. Okay, so basically, what happened that in this case, they tried to analyze the biological profile, the age, the sex, the ancestry, how I mentioned the description. Okay, they analyzed it and then they tried to make a complete face of the individual so that from the missing persons database, right? This missing persons database is created when, whatever information is there available to them, but they are not aware of the name. See, this missing person is not being reported by the family members. This missing person was basically reported by whom? This person was reported by the NAMUS system. They got this data, they got a body somewhere outside the zoo, okay? And when they got this body, what happened? They just tried to figure out what is the probable, description. Whatever they just saw, they just took it, describe it in the notes, right? So now we are talking about how they figured out and how this case was being processed. They have taken the radiographical features from the skull. They have created the 3D replica of the skull. Okay, from here now understand the case. See, so basically this is the 3D replica over which they have tried to, put up clay. See, so basically they have firstly reconstructed the muscles, okay, in this way. The case number is being mentioned on the replica and they have put it a layer. These are tissue depths or the tissue stops. Eye sockets are put. Okay. Scalp, yeah, scalp and eyelids are added. Everything they have added. Uske according they have tried to reconstruct this face. Okay. Then they have used the software, the relatable features जो कि that can be seen from this particular. See, this is the particular, clay wala buildup that they have created. And then they have used the software to give features to this, the same superimposed features for this buildup. See, also with the description they got, they have tried to incorporate black mustache, black wavy hair. You are understanding? They have combined this data. See. So this could be the probable face with exactly superimposed proper markers. Okay. So now they have posted it on their social media and they are saying that let us get to know that who this person is because we got it from the namers database and we got about this body. This is the case that we picked up from the Namers database, okay, from New York, and then we have reconstructed the skull to give a proper clarity. Because when they got the body, it was partially decomposed. The facial features were not that clear. Okay, so they have clearly demarcated the features based on what? Based on the anthropological data. Okay, based on the anthropological data that was being written when this body was found and that was being processed by the forensic anthropologists. I hope it's clear. Okay, so now they are just saying that if this, because this is the probable face of the individual, so if any face is matching with this face and any family member knows it, they have shared it on social media. This is from LinkedIn. So they are just asking that if you know these are the features. Here the body was found. This is the anthropological data, whatever we have processed. So please let us know if you know this person, and then we'll move with the further investigation. And further investigation would be probably what? The genetic analysis, that is the DNA analysis. Okay. Okay. So this is how a short, again, this case is little bit, practical. So I have mentioned it in this. Okay. Now we'll go with the next case. Okay, so this is one of my favorite cases that I am showing you here. I have taken permissions from Dr. Shubhakar Paul sir, and he is basically a forensic medicine specialist and a forensic pathologist from Scotland. He has solved this case and he has tried to incorporate each and every step that they have done in this case processing. How the case was found, till how they were able to hand over the remains to the family members. Okay, so this complete case is being videographed and basically they have put it. I have taken permissions from sir and he has given me the permission to share this case with you. So now we'll just see this case. Okay. So here also Joe Millen sir has helped in, getting this imaging things. So this is Oscoxay, the pelvic bone part. This is the scene, the field from where, see, flags are there, from where the bones were, recovered. The skull is there. He is Dr. Shubhakar Paul. Then the long bones. Okay. So this is the real case. This is the real recording. See how each and every bone is being recovered. And how pathetically sometimes the fields are. See how much, you know, like it is being there in the leaves, in the branches of the tree. See, this is the paper sheet on which he's putting up each and every bone. The right side, left side, medial side, distal side. Whatever bones he is getting, he's trying to put it according to the skeletal, ratio, skeletal positioning. So these bones were being found and now they are in the lab. Also, they have the animal bones. We mentioned about commingled remains yesterday, right? Then they went for the CT scan of the skull. They took the skull and did the CT scan. With the CT scan, they got what? The features of the skull. And then they just put it for 3D printing. How they have 3D printed the skull, this is all what they have done. See. Because you can't use the skull as it is, no? You need a replica, you need a model to make it handy to, do the proper analysis. So this is very important, especially in foreign countries, they do it. They just print the skull. This is how the software was, mentioning about we have completed this 3D printing of the skull layer by layer. So this is the replica. Now they are trying to, do the facial reconstruction by the forensic imaging specialist, Joe Mullensaro. He is Joe Mullensaro. He basically takes cases from Nemus, and this is also a case from USA, Virginia. See how properly they have created it. See, just I'll just pause it once and show you. This is how they reconstructed the face. Okay, this is the probable features when they digitalized it. So these are the proper markings of the face, how the face could have been. Okay. And then they got to know that, okay, this person is missing from that particular region. This is the face of that person. So they just tried to relate the features. See it again. See, the face is not exactly like that, but so many features are matching. You can say that this person could be this person. Then they called the family also, and they just gave a proper dignified respect to the body remains, packed them properly in this paper bag, in the cardboard box, and then give it a proper disposal. After the case has been done, this is how they basically sit together a forensic medicine specialist, a pathologist, and then a forensic imaging specialist. They discuss about the case, that what were the difficulties, what was your opinion on it, is the data sufficient that we are handing the body over to the family members. So anthropologically, the things were matching. This is how the face was, and the face was nearly matching a lot with the image of the missing person. The family members were searching. Then they discuss each and everything. They discuss that not only based on this we are concluding it, but also it has given us a recognition lead that yes, this case was that, like, this person was the only person who died. But this investigative lead was so much prominent in this case because, every other thing matched, of course, genetic analysis and all the other things, whatever they do with the team. But the facial recognition was so good that you can say, as you have seen, you can say that this person could be the person who died. See, basically, they send the remains to the family members. This is how things get completed. Okay. Okay, so now we have this another case. Okay, and this case is, we are going to discuss each and every line of this case, each and every feature of this case through the case report article that I am sharing. Okay, that article along with all the three PPTs will be shared to you in the group. And this case is from the year 2022, wherein there was this dismembered body that was being discovered in northeast region of Brazil. Okay, so this I'm sharing region. Just pay very keen attention because here the everything whatever we have learned will be summed up, and you will get to know how you report things, how you analyze things. This is a very interesting and a very comprehensive case. So please listen it with patience, relate things. Okay. And this is the last case of today. We have also, mentioned some cases yesterday in short, but this case particularly we are talking about in forensic anthropological context. So pay attention. Okay. So basically, several decomposed body parts were being found and they were being received by the Forensic Anthropology section of Medical Legal Institute of João Pessoa in basically Pereba, Brazil. So what happened that there were some portions of upper limbs, ribs, vertebrae, skull that was thoroughly being examined. And when they created the biological profile, they were able to understand that this person could be from the age range of 23 to 57 years with a strong, predilection towards 35.2 years with a standard deviation of 9.4 years. See the age range. Okay, 9.4 plus minus hota hai. So 35.2 years plus 9.4 years, 35.2 years minus 9.4 years. This is the complete age range. So they have mentioned the mean age of this age range. Hope it's clear. Okay, so the skeleton showed a lot of injuries. We have already studied in the first lecture that we analyze the trauma as well as forensic anthropologists have to make, rule out whether the injury is by a sharp force trauma or a blunt force trauma. Okay. Then the lesions are mainly in the diaphyseal segments of long bones, sacrum, pelvis, mandible, maxilla, scapula, sternum, vertebrae. See, so much trauma in the bones. Distal epiphysis of left fibula, distal epiphysis of the left tibia. Even there are injuries that can be said that they are perimortem in nature. What is perimortem? Before death, right? Just before death, you can say sometime before death. It was not possible to determine the cause of death, but the DNA analysis resulted in a positive identification. Okay, but if we are talking about the forensic anthropological context, how forensic anthropology helped in solving this case, this article is all about it. So, with each and every picture, how the case was reported, we are going to understand it. Also, from this article, we will understand certain behavioral aspects of how dismembering of the body remains is being done by the criminals. Nowadays, dismemberment cases are increasing day by day. Every day only you are getting a case that this person's body was being dismembered and this was there. So in forensic context, we also have this, behavioral context as to understand the intention of the criminal, right? So they have mentioned this particular classification of the people, of the criminals who do the dismemberment, what are the ways they do dismemberment, and what is the psychological behavior. So we'll mention about that as well in brief, but you need to understand that how behavioral aspect is also related to the anthropological aspect. So let's get into the case now. Okay, so basically, an open area of the metropolitan region, they were able to find in the northeastern Brazil certain decomposed body parts, right? So, the parts with decomposed soft tissues were inside closed, untorn plastic bags that were spread over a forest area. See how the remains were being discovered. See the pictures. In plastic bags, the remains were found like this. These are the real pictures of the case, so understand it. I think I can. See. Okay. Okay, so basically they were being found and from the crime scene, then they were being sent to the forensic anthropological section of that institute. After that, the upper and lower limbs and thorax were found to be segmented. There was a lot of even putrefying soft tissue in the sectioned structures that were being sectioned. Okay, so there was this putrefying soft tissue that was present in a large amount. So, how they approached the case, a woman contacted the forensic anthropology section claiming the examined dead body was her son. Okay. So she said that her son was basically missing from 15 days, and but she didn't have any antemortem records, the medical or dental records. So she said that my son was being missing from 15 days, and I believe the location from where you have recovered this body is of my son. Okay, so then that lady was being referred to the forensic genetics section, and she was told to provide her genetic material so that they can get to do the DNA analysis. Okay, and then they also carried out the DNA analysis using a fragment of the right femur. Okay, which resulted in a positive identification. Bones में से DNA analysis, we can do it from certain sections, and it depends upon the availability of the bones, how the bones are recovered, what is the state, how basically you can do the DNA analysis. So this part was being done because of this lady. So this helped in the positive identification, right? But how, ठीक है, DNA analysis हो गया, fine, but how the anthropological aspect helped in solving this case, helped in getting to know that how the person died, and like, is that person like, are there enough traits, are there enough findings to confirm, if we don't have a DNA analysis, are there enough findings to confirm the person is this person only? So this is how basically things work out, because when you are working in the teams, na, each and every team will do their work. They won't try to just discuss so much before analyzing or even after analysis. When the analysis is completed by each and every section, then the things are reconciled, or they just sit together and understand that, okay, that how we saw in Dr. Shubhakar's case, that they sit together and then just discuss, these are my findings, these are my findings, okay, okay, fine. So in this way, this section did their work. Then forensic anthropological section, how actually they did the work, we are going to understand that in detail. Okay. So basically, firstly, what they did, the decomposing soft tissues were being removed manually, okay, and they were being placed in the hydrogen peroxide solution diluted in water in the ratio of 1:1. Then the process of cleaning was completed under hydrogen peroxide. Okay. As they have mentioned that the body was segmented, the remains were segmented. So certain soft tissue areas were being present. Soft tissue was present in a lot of amount that needs to be completely cleansed. Then only you can go for the anatomical or osteological analysis, right? So the skeleton was then placed in the anatomical position to allow a thorough examination. So as we saw in Dr. Shubhakar's, video, he was trying to position each and every bone according to the skeletal anatomy, right? So whatever remains they got, the skeleton was then placed in an anatomical position. And anatomical position is the ideal position that actually gives a complete overview of the skeleton, and that helps you to do the further analysis. Okay. So this allowed a thorough examination, and after observing the gross osteological comparison, anatomic continuity of the body parts. Now, be very much careful here. Experts inferred that they all belong to the same person. How the classification of the morphology was being done. Now, they are talking about the hip bone. Greatest sciatic notch, score 4. C. We mentioned about 5 scores, right? 1, 2, 3, 4, 5. उसमें भी probable, definite female, right? I hope you remember that. So basically, this score 4 is probable. It's probable what? Okay, just tell me. I want to see how much you remember. Just tell me in the chat box. Score 4 is what? I want to see. Where's the chat box?
Everyone, please answer.
I can't see any answers. Hmm. Okay. Okay, chalo, I'll tell you. Should I tell? Nobody is going to tell. किसी को भी याद नहीं है. Okay, I'll tell you. Fine. So basically, the classification of the morphology of hip bone, right? Hip bone में greatest sciatic notch is given the score 4. Score 4 is probable male. The scoring was like 1, 2, 3, 4, 5. If you remember, 1 is female, second is probable female, third is indeterminate, right? Fourth is probable male, 5 is definite male. So score 4 means probable male. Okay. Ventral arc male means score 5. Okay. They have simply written it male because it is definite, right? For scoring criteria, when you are a little unsure, especially in cases of scoring 2, 3, and 4, probable female, indeterminate, and probable male, then you need to mention the score in the report. Okay. So subpubic concavity male, ischiopubic ramus ridge male, preauricular sulcus is absent. Okay, this is also a finding. Then absent किसमें होता है? So basically it's directing towards male. Okay, skull में knuckle crust has scored 4 again. Mastoid process has scored 4. If you people are not able to relate, I will put up this PPT if you want. I want you to be crystal clear with the concepts. That's why I'm trying. See, 1, 2, 3, 4, 5. This is how each and every, I told you how the margins are being drawn. So they would have seen this one and not exactly this for a definite male. Male, probable female, indeterminate, probable male, male. Female 1, 2, 3, 4, 5. This is how scoring is done. Okay. So, so in this way, basically, the scoring is being done or vital margin score 5. यहाँ पे score 5 mentioned है. Okay. Clavicular, supra or vital will score 5. Okay. Definite male, only male, whatever you call it. Mental eminence score 4. So एक feature, whatever they were able to understand, they have tried to feel it, give it a score. So basically, what these values present that they were consistent with a male individual. The estimated age range was 23 to 57 years. Okay, both clavicles presented a complete fusion of medial epiphysis, suggesting an estimated age of over 29 years. So ये एक फीचर था जिससे एज एस्टिमेट करने में they were successful that okay this individual probably is of the age above 29 years. Then what they did, the metrical and morphological information from the skull was being shown in different parts and like it was showing different ancestry estimation patterns. Okay, and it was shown in this basically these softwares or the website. Sometimes people use it in order to understand how differently ancestry is, trying to give you a different result. As I mentioned earlier, that there are certain percentages. So basically, ancestries, HEFNE are these are free to use statistical programs that are there on the osteomics website, okay, and they were being used for evaluating the ancestry, understand the different patterns of ancestry, and they were being used in these two softwares to give different analysis. Okay, so the metric analysis resulted in 93.8% probability that the bones belonged to a person of North Asian ancestry. Okay, the morphological analysis, but इसमें what they have done, the metric analysis was being put in this software. The morphological analysis was being put in this one. I won't say software. Okay, I will say program because it is on a website available. So ancestries and HEFNE are that resulted in the African ancestry. See, different results again. You get mixtures with a probability of 68.8%. So these are the typical findings that were being, found. Okay. So basically now I'll show you this. This is how the remains in such a pathetic way they were being discovered. So the case number has been hidden here. Essay like this, the bones were being found, recovered. Then they did the trauma analysis. Okay. So basically, what they found out that the injuries were caused by sharp force and sharp blunt force trauma. Okay. So these combinations were being present. There were no animal bites. We mentioned like I mentioned in the last lecture yesterday that for even differentiating the teeth and also for differentiating the bite, we need to understand whether it's of human origin or animal origin. So there were no animal bites seen because the body condition in such a way many a times animals wander around and just sometimes just make the case a little more complicated. They just fetch the bones and just run there here and there and just put up any bone somewhere and somewhere else. So it is difficult to sometimes analyze because of the animals and because of even the geographical conditions, because of certain, environmental conditions when also the geography because what field you are getting and how the environment is there, everything matters, right? And animal intervention is very much important in forensic anthropology and or archaeological cases. Okay, so injuries were seen on maxilla, mandible, and the clavicle. Manubrium showed a complete section with the loss of its lower third. Okay, and there was also an interesting and rare anatomic variation. See, Kali, we were discussing that there are some unique features. So there was this unique feature here that can also help in individualization and positive identification. So the suprasternal or episternal bone was present. Okay. So this finding occurs in 1.5% to 4.1% of populations and can be very useful for human identification. I'll show you the pictures. Figure 5. See this kind of a notch. It's rarely present. It is also an identifying feature. Okay, this is what can anyone tell me? अच्छा इसमें तो लिखा ही है छोड़ दो. ABFO number 2 scale. This is also being used when you are doing the metric analysis. Even in bite marks, we use it very, mandatorily. We have to use it. It is necessary to use it. Okay. So both scapulas and proximal epiphyses of the left ulna showed several false starts on its medial side with eversion of the bone margins. The humerus and radius showed injuries caused by blunt force and sharp force trauma. Figure 6 and figure 7. I'll show you one by one. How the bone margins are. I hope you can appreciate. See, like this. So bone crack होती है ना. So basically when you cut it, the part gets fragmented and there leaves a margin, right? So this margin was seen, broken है. यहाँ पे भी there are different signs. Sharp force trauma है, blunt है. I hope you can see. Hmm. Okay, illustration of the skeleton showing the locations of the injury. Okay. See, ये रेड क्रॉसेस जितने भी हैं, ये सब आपके इंजरी पार्ट्स हैं. So badly the injuries were inflicted on each and every bone. See how the complete skeleton is made. Okay. Can you appreciate her broken bone? No, okay. The second showed chop wounds. We have seen all the pictures, right? Okay. So this there was this one finding that there were no injuries in the neurocranium. And this confused the anthropologists, and they said that we can't clarify that whether the injury was being inflicted perimortem in a perimortem manner or after the death, postmortem. So injuries had the perimortem nature or the postmortem nature. They were not clear with it. Okay. And they confirmed the dismemberment but could not equivocally relate the presence of the observed perimortem injuries to the cause of death. They can't relate it with the cause of death as well. The cause of death could not be conclusively determined. So this is how, even if you have got negative findings, you are not clear with your, findings, you mention it. Whatever you are seeing, just mention it with honesty. So now I'm talking about the behavioral aspect of dismemberment that they have mentioned very nicely in this article. So I'm just sharing this with you. Okay, in the discussion part, this article will also be shared. Okay, so there are basically three types of dismemberment that occur. Defensive dismemberment, aggressive dismemberment, and offensive dismemberment. Dismemberment क्या है? Basically what it is. So when the body is being, cut, or when the body is being tried to so brutally packed in different packages, or they are just being, the body parts are cut and thrown away. So when the body is being dismantled, you can understand, right? So जब उसको we put it into certain fragments or pieces, then dismemberment occurs, and dismemberment is of three types in behavioral aspects. So defensive dismemberment में क्या होता है? What happens in here? It involves facilitating the transport and disposal of the body, or to make it challenging to identify the victim. Okay, so basically, what the dismemberment, defensive dismemberment, may basically what happens, that they try to facilitate the transport and disposal of the body. They just, the body is dead now, so transport and disposal के लिए they try to make the victim identification challenging in such a way that they dismember the body and transport and dispose it. Clear one, जो बहुत easily, जो कि maximum commonly we are able to witness this in many cases. So this is the defensive dismemberment. Second one is aggressive dismemberment. It is related to the aggressor's impulse to dismember from worry, indignation, or emotional unrest. Okay. So that person is basically furious, or it's just emotionally unrest that I have to dismember this body in any situation. That person is so much impulsive. So aggressively sometimes the body is dismembered. उनको मतलब जैसे कहते हैं ना कि चैन नहीं पड़ रहा, I have to do it just impulsively, so psychologically, drained and disturbed, that they are doing this in aggression. So this is aggressive dismemberment. If I talk about the offensive dismemberment, it is when the perpetrator shows personal pleasure and gratification from inflicting pain and dismemberment, which is part of the motivation for homicide, usually driven by sexual desire, fantasy, strong anger, or sadism. So when extreme emotions are there, okay, extreme negative emotions are there, and when the person, when the criminal is so much motivated and just want to have certain pleasure and gratification, just wants to inflict pain, just want ki that person feels it, and just they are just doing it out of their fantasies, enjoying this, then the dismemberment that is being done is the offensive dismemberment. So this is very disturbing to know, but yes, this is what it is. In forensic, you have to understand this also. Because whenever, if even you have seen CID, no, they tell कितनी बुरी तरीके से मारा है. They say like that, right? कि किस mental state, and what could have been the mental state of the criminal when the dismemberment was being done. So this is how defensive, aggressive, and offensive things are. So sometimes you're able to understand the type of dismemberment as well, okay, when you are analyzing the body. And also whenever you are doing any forensic case, no, there are certain gut feelings you always follow. Whether the case is small, whether the case is a high profile case. You have to follow your inner voice, and when you are we are having positive intentions, you can understand a lot, even if you know a part of it only. You can understand things. Just be very honest. Don't make up anything. Just see, just understand, just make your foundations very clear. Then only do the analysis properly whenever you will become forensic scientist, anthropologist in future. Okay. 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 So also, okay, I have mentioned the three main types. We won't go in much detail. Okay. Okay, so basically, whatever they were able to analyze, they documented it, analyzed it, gave it in the report, and then when the this DNA analysis was being done that confirmed that yes, male hai, wohi age, the same age range. The DNA is matching, the things are clear that yeah, this person is this one, right? But even if they would have, if the body would have been in a good state, then they could have taken fingerprints and dental records to think they were not having antemortem dental records, even no medical records were there. So that also weakens the case when you are doing the analysis. So it was completely a reconstructive identification. And if we talk about the genetic DNA analysis, that was a comparative identification. Ab samajh aa raha hoga. I hope you are understanding how the biological profile has actually been created, right? So this is all for today. We are done. Trauma analysis, sex, age, ancestry, stature, everything. Bones, mein whatever you are able to understand. Now just do the profiling, biological profiling. Try to reconstruct the identity. Even if you have certain comparisons, comparative identification can be done. Sometimes suspects may, like in bite marks, what we do. If we have four suspects, we analyze the bite mark found on the victim and then we just compare, superimpose, and then we can say positive identification is done. So comparison is important when you have a good amount of antemortem record or a comparative, records available with you. So this is all for today. We are done. Okay, and thank you very much. I hope it was interesting. I hope you were able to understand the case cleanly and you were able to see the pictures, see the videos से भी पता चला होगा you could have understood that how things are actually happening, what you study and versus what actually happens, what is required, everything, how analysis is taken, you know, everything. So I've covered it all from my side. If you have any doubts or any questions, you can ask. If you want any case to be played again video, तो मुझे बता सकते हो. You can tell me. I'll play it again. And when the PPTs will be shared, the links will be here, so you can see them by your own as well. Just let me know.
Everyone, if you have any doubt, you can ask.
Yes, I can see your hand. Okay.
Ma'am, one doubt, ma'am.
Yeah, please ask.
Ma'am, disaster victim identification is how possible?
Like how possible in a particular case context, or you are asking in general?
Disaster, ma'am.
Hmm. See, if you are talking about a normal disaster, disaster victim identification requires certain teams, okay? So, wherein there is this one team who just goes to the scene. So, then there is this one team that processes the records, and the one team is there that is the team that analyzes the post-mortem records. One team is there for anti-mortem records. Another team is there for reconciliation of anti-mortem and post-mortem records. So in this way, they just try to understand. Teamwork is done by different specialities also. See, this is for anti-mortem record, post-mortem record. Whatever I'm saying is in context of remains. For example, forensic anthropological. So anti-mortem section here, so there will be databases. And if we are talking about post-mortem sections, the evidence goes one by one to different departments. For example, it has gone to the forensic anthropological department, then it will go to the DNA department. Okay, in this way, they try to analyze and compare the records and then give conclusions whether the identification is probable, possible, or it is positive identification. So in this way, things go in disaster victim identification and primary identifiers that I have mentioned are basically fingerprint, dental, and DNA. So these are given the most, the higher priority. If you get the dental records, great. If you get fingerprints, very nice. If you get the DNA, that is also a primary identifier. So if even in one of these primary identifiers, na, if you are able to comparatively give a positive identification, that positive identification is considered. Also, I'll tell you the last thing that even if you are doing the dental profiling, we never give up the cases in such a way that, okay, one thing I have analyzed, only the dental profiling, this thing is matching. No, you have to do it comprehensively. You have to study all the teeth and whatever methods that are applicable. Even if you want to go for age estimation, you are reconstructing, right? So for age estimation also, you will consider the teeth, you will do the DNA profiling also, match with the missing persons data reconstructively, sex determination, if it is possible, do it. In age estimation also, if you are doing the age estimation, try to use maximum methods as you can. So in this way, every team works.
Okay, ma'am.
Good evening, ma'am.
Good evening. Yes.
Ma'am, I have a question.
Yeah.
Ma'am, whenever the skull is damaged and cannot be used for a facial reconstruction, which other method can be assist in that identification, ma'am?
Okay. So in that identification case, whatever part of skull is available to you, you
Yes, ma'am.
just try to analyze the age and sex through the features that you have studied.
Yes, ma'am.
Okay, and then what you do, you basically try to analyze the basically the fusion of the sutures also.
Yes,
If
ma'am.
you have got this scalp part, okay, you are
Yes, ma'am.
able to understand ki there is this fusion of sutures, and this is basically the grading. This grading is given for the sex.
Yes, ma'am.
So all the features that are available to you, you can do that. And if you don't have anything else other than the part of the skull, you also go for DNA profiling.
Yes,
Yeah.
ma'am. Okay, ma'am.
That is done in, yeah, that is done in cases where you have the comparative records
Yes,
and
ma'am.
wherein you are done with your anthropological investigation, then DNA is being done.
Okay, ma'am. Thank you, ma'am.
Okay. Yes, yes. Kanishka, yeah,
Good
please
evening,
ask.
ma'am.
Good evening.
Ma'am, when bones are cut, crushed, or chemically damaged, how do anthropologists differentiate between trauma caused by the offender and damage caused later during or recovery or decomposition?
Okay, so basically in that case, as we mentioned in this, as we were studying about this one, no? The last case, in this case, neurocranium changes are being, understood that there are no neurocranium changes. Now it depends upon the case. Okay, sometimes what happens that the bones are so much fragmented, right? You are able to understand that the bones that are being fragmented, they are that is basically crushed in such a way that it got naturally or it is being inflicted by certain trauma forces. So the thing that firstly you have to analyze is that are there any instrument marks on the bones? Okay, even if you get thousands of fragments, na, there are certain marks. So that marks are basically an indicator that whether that were being cut with the instruments, the any kind of injury was being done or not. Also, in this case, when you have to, differentiate between perimortem and postmortem injuries, you need to understand other forensic pathological things. Like microscopically, you need to check whether the bone remodeling has been done. See, cortical remodeling I mentioned in the first lecture, right? So what happens in that, that you are understanding the bone was, fragmented before death, then there will be certain changes by the osteoclasts and the osteoblasts. In the microscopic structures, you will see it. So if that is there, it means the injuries were being inflicted before death, perimortem day. And if there is no bone remodeling, then the injuries are most probably being, inflicted after death. This is an indicator that you can use. I hope you understood it.
Yes, ma'am. Thank you.
Um, uh,
Anyone else?
yes, ma'am. I have one more question.
Yes, Amonika, yes.
Yes, ma'am. Ma'am, the femur shows a cut marks. Okay, ma'am. But the
Hmm.
surrounding bone has no healing. Ma'am, how we can identify that it's antemortem or perimortem or postmortem trauma, ma'am?
Okay. So if there is a cut, you are
Yes.
saying there is a cut, but there is no changes in the
Healing.
tissue.
Yes, ma'am. But the surrounding bone has no healing, ma'am.
Okay, so no healing is there, so it is clear cut that it is post-mortem. Okay.
Okay.
Even if the healing has started now, like if there are certain spikes you are able to see of osteoclasts and osteoblasts, then
Yes,
it
ma'am.
can be said it is perimortem.
Yes, ma'am.
And when you are estimating the age, or you can say when you are estimating the cause and manner of injury, na,
Yes,
then you
ma'am.
can understand how the perimortem injury is differentiated from the antemortem one.
Yes, ma'am.
Antemortem we confirm when we have the medical reports and records present with us.
Mm-hmm.
And most probably we don't find such records because, like, if that person could have gone through an injury, that person could have got treated it, right?
Yes,
So
ma'am.
there would have been any device or anything like knee replacement or anything would have been done. Certain screws would have been there.
Yes, ma'am.
So even if it is a case of upper limb or lower limb, you can see certain treatment. Treatment basically, you can say prosthesis.
Yes, ma'am.
So that helps you determine that okay, this is an anti-mortem stuff. Mostly this is seen.
Okay, ma'am. Thank you, ma'am.
Okay, thank you so much, ma'am, for sharing your knowledge and expertise with us throughout these sessions. And we are truly appreciate your guidance and support. It has been a great learning journey for all of us. Thank you to all participants. Your second assignment will be provided soon. So see you in next session. Have a great evening ahead. Thank you so much.